Thank you very much, Ken Corlon. I very much welcome this opportunity to once again update Dáil Éireann on the COVID-19 disease and our national response to it. Let me start by expressing my condolences to the family and friends of those who have been lost to this awful disease since I was last in this House. This is an individual loss. It's also, though, a sense of national loss. We all share in your loss. Today I want to first update the House in two ways: by providing the latest information I have on our ongoing modelling work, and by sharing some key messages from my discussions with the Chief Medical Officer, Dr. Tony Hoolan, today. Ciancórla, colleagues will recall that the R0, or the reproduction rate, was previously in a range of 0.5 to 0.8. I am advised that that range is now as low as 0.3 to 0.8 in some estimates, and that the overall rate is now considered stable at around 0.5. The other data coming through in the modelling is the number of admissions to hospital and to intensive care units. I'm pleased to inform the House that both of these have halved in the last week. Last week, hospital admissions were around 40 a day, whereas this week, I'm told by the modelling that it's around 20 a day. And last week, ICU admissions were around 4 to 6 a day, whereas again, the modelling now tells me it's around 2 a day this week. In long-term residential care settings, the number of cases is declining now, based on preliminary data, from about 100 new cases a day in early April to around 50 a day towards the end of last week. These significant decreases are welcome signs of progress, and they are the tangible results of so much hard work across our health service and indeed across all of our country. I want to say a genuine thank you to everyone working so hard. As I said earlier, I want to now share with you 4 key messages from my discussions today with the Chief Medical Officer based on the stage we're now at as a country. Firstly, as the public health measures in our society begin to be lifted, our personal behaviours will become more important than ever to protect ourselves and to protect each other. If we continue to wash our hands, practice coughing and sneezing etiquette, and maintain social distancing, we can move more safely to our next phase when the 18th of May comes about. Secondly, the levels of disease in our community continue to decrease. This now gives us an opportunity to go after this disease where it is and to focus our attention on places that are at higher risk of outbreaks, such as workplaces and other congregated settings. Thirdly, the World Health Organization has said that this disease may be with us for a long time to come. It will be with us either as low levels of transmission or as waves of higher infection rates. In order to be prepared for this, we must as individuals continue to remain vigilant and as a society be ready to reintroduce public health measures when necessary. Fourthly, as a country we have pushed back this disease through working together and protecting ourselves and protecting each other. As we continue to do this in the future, we continue to be stronger than this disease. The sacrifices that we have made, the work that we have done, and the solidarity that we have kept have pushed back this disease enough so that we're now able to begin to tentatively plan for a reopening of our society and our economy. But let me be very clear, this progress is fragile, and this plan depends on all of us remaining resolute and relentless in our national effort to suppress this virus. Our roadmap is published, and we're working to move forward with it, but we do so with all due caution. The protection of the health and lives of our citizens will continue to be our primary concern. When we come to consider any further easing of restrictions, we will continue to rely on our expert public health advice, and we will have regard to the latest data on the progression of the disease, the capacity and resilience of our health service in terms of hospital and ICU occupancy, the capacity of our sampling, testing and contact tracing programme, our ability to protect and care for those most at risk from the disease, and also, importantly, an assessment of the risk of secondary morbidity and mortality as a consequence of the restrictions. We will make our decisions based on this advice and data, along with considerations as what's best to do for our society as a whole. We have pushed back this disease collectively, but it has certainly not gone away. It can return with ferocity if we do not remain vigilant and retain our ability to be flexible and agile in our response. We will not risk losing the ground that we have gained against this disease. The people would not wish us to. All of our decisions will continue to respect the hardship and the sacrifice that so many have made to bring us to this point. As I already mentioned, a critical element is our ability to test and contact trace so that we can limit the impact of future outbreaks of COVID-19. Our target testing capacity remains as advised by the National Public Health Emergency Team on the 17th of April. the ability to do 100,000 tests per week, operating on a 7-day week basis for a minimum of 6 months. The HSE has developed a plan for building its capacity towards that target, and I'm pleased to say it is now delivering real results. Significant progress on building and increasing testing capacity has been made in what objectively must be seen as a short space of time. The result is that capacity has now expanded to 12,000 a day, and turnaround times have significantly improved. The HSE is now stepping up capacity to 15,000 tests a day in the next 2 weeks. Turnaround times will continue to improve, and we should see average turnaround time from swab to result of 1 to 3 days by the 18th of May. We're continuing, and this is important and welcomed, I know, by our GPs and by health professionals, to widen the net of groups being tested to meet this capacity. Now that we have extra capacity, we're widening the criteria in terms of who can be tested, and this is good as we continue to aggressively go after this virus where it's most likely and also where it will do most harm. So we will continue to strategically target testing to vulnerable groups, and those testing priorities will be decided, let me be very clear, by public health experts and by the National Public Health Emergency Team, and they won't be political decisions. We'll target that testing where it can do most good in terms of going after the virus where you're most likely to find it and in groups in which it's most likely to do harm. The behaviour of this disease in our residential facilities continues to be our area of greatest concern, despite what I think people would have to acknowledge is a significant improvement based on the modelling data in terms of the reduction in the number of new cases. Our 23 response teams across the country, led by senior nursing support, will continue to provide senior clinical expertise, infection prevention and control and public health input to prevent and manage clusters in nursing homes and other residential facilities. And when we get into, no doubt, the questions and the answers, we'll have an opportunity, I think, to outline some of the benefit we're now seeing from the home help agreement in terms of the redeployment of staff from that sector into our nursing homes as well, which has begun in earnest this week. We have, as you know, prioritised testing in our long-term residential care setting. I think that has yielded a real benefit in terms of getting on top of this virus. And our regulator, crucially, the voice that we, the Oireachtas, put in place to oversee safety in nursing homes, HIQA, will have ongoing oversight of the response of these facilities through its COVID-19 Quality Assurance Regulatory Framework, and its visits to nursing homes started at a very good meeting with HIQA yesterday on that as well. Last Tuesday, we were able to increase the distance which people may be able to go to exercise to up to 5 kilometres. And we could also provide advice to those who are cocooning on how they can safely take some exercise, as long as they do take those necessary precautions in the interest of their own health. I do want today to say a special word to people in this cocooning category. I know this is an uninvited label, and it's a very much unloved label as well. I'm actually not sure where the word came from, but I don't think I've yet to meet anyone, including myself, who likes it. People who are well aware that they have an increased vulnerability to this awful virus, but they do not associate their ordinary non-COVID lives with vulnerability. You know, people in their 70s and 80s in good health. Following the advice on how best to stay safe contrasts starkly with a life lived normally, actively, resiliently. And I do hope the increased activity suggested by the recent advice helps, and we want to build on that. We'll continue to honestly provide the advice on the best way for those most adversely affected by the virus to stay safe. So we don't do it to in any way cause offence, we do it in order to impart the best possible medical advice. And I hope as we further together suppress this virus, we can get closer to those normal lives as quickly as possible. We were able to bring in these changes, and we were able to begin to tentatively plan for the reopening of our society and some of our economy, because our country has acted as one in doing what it takes to suppress this disease. We can continue to move forward safely and look forward to better days if we stay the course and remain vigilant. I want to conclude by expressing my gratitude for the continued unity of this House in supporting the public health advice, whilst rightly scrutinising the government response, and I very much welcome the establishment of a new Oireachtas committee, which I know is set up to aid that effort. On that note, I have to ask all of us to stress the difference we can all still make between now and May the 18th in really weakening this virus as much as we possibly can, and we now know how to do it as a country. Wash your hands, cough and sneeze properly, keep your distance, stay at home, stay safe, mind each other, protect each other. That's how we're going to make sure these days between now and the 18th of May really count, because the weaker we can make this virus during this time, the greater chance it gives our national plan of success, that we can press go and proceed with trying to get back to some degree of normality, and the greater the opportunity will be to save lives and keep people well. And I know that's what we're all about.
Thank you very much.